Okay, so let's talk about the heart, about the structures of the heart, the parts of the heart, and the route of blood, the route that blood takes through the heart into the body. So we know this is the anterior view of the heart because, well, one, we have the right auricle right there that goes onto the right atria, or atrium here. Then we have the left atrium, the right ventricle, the left ventricle, and we can see our aortic arch here in our superior and inferior vena cava coming into that right atrium. If we flip it over on the posterior side, we can really see that aortic arch right there, and that's going to lead up to the carotid artery, and then to the subclavian arteries to the arms, and then the descending aorta here to the rest of the area of the body, the lower body. And we have our pulmonary arteries, our two pulmonary arteries coming from the pulmonary trunk, which you'll be able to see. And it's coming from the right ventricle. So, and then when we can't really see them on here, but if we look on our left atrium, we're going to be able to see some, well, you can see the holes right there. That and right here are going to be your pulmonary veins. They don't show them here, but right there and right here are our pulmonary veins. And remember, pulmonary just means lungs. So the pulmonary artery is going to the lungs, artery away from the heart. Oh, come on now. Where you at? Artery away from the heart. Dang it. Away from the heart, pulmonary, lungs. So away from the heart to the lungs. Our pulmonary vein to the heart from the lungs. So the pulmonary vein is going to be bringing oxygenated blood back from the lungs to the heart to be dispersed throughout the body. The pulmonary artery is going to be taking deoxygenated blood away from the heart to the lungs to become oxygenated. So if we kind of make a cut here, I did it earlier really well. Hopefully I can do it again. Let's get rid of that. Nope, didn't do it. So maybe a bit more here. There we go. That's what I'm looking for. So if we look at the interior of the heart. So right here is our right side, our right atrium. Our right atrium, our right ventricle, our left ventricle, and our left atrium. Those are the four chambers of the heart. So as deoxygenated blood is going to be coming from the superior and inferior vena cava, they're going to empty into the left atrium. That left atrium is going to pump or contract and force blood down into the right ventricle. And it's going to go through that tricuspid valve right here. I wonder if you can see it. Nope. So it's going to kind of contract and force blood through that tricuspid valve into the right ventricle. And then when that valve shuts, that right ventricle is full of deoxygenated blood. That right ventricle is going to contract, and it's going to force that deoxygenated blood up the pulmonary trunk, out the pulmonary arteries, to the lungs. And the lungs are going to be oxygenating that blood. So every time you breathe in the really deep breath, you're putting oxygen into that blood in your lungs, and you're exhaling all that carbon dioxide from cellular respiration, that byproduct of cellular respiration. So as it pumps that blood to the lungs, this atrium is going to be releasing and relieving pressure so that blood can then fill back in, and then it's going to keep going vice versa and emptying and contracting, empty, contract, empty, fill, just like that. And then when we come back from the lungs, we'll come back to the left atrium right here via the pulmonary vein. The pulmonary veins, that's a pulmonary artery that's coming out of the, let's get rid of that. So pulmonary vein is going to be coming back with oxygenated blood now from the lungs into that left atrium. As it opens up, it's going to allow that blood, that oxygenated blood, to fill in And then once it contracts, it's going to force blood into the left ventricle here through the bicuspid valve or the mitral valve. The bicuspid valve is on the left side, the tricuspid valve is on the right. So as that oxygenated blood fills the left ventricle, that left ventricle is going to fill with blood, and then it's going to contract, and that oxygenated blood is going to go out the aortic semilunar valve into the aortic arch, and then it's going to go throughout the body. Your body needs oxygenated blood. So all that oxygenated blood is going to go throughout the body. And if you notice, your left side of the heart has a lot more myocardium or muscle on the left side here than does the right side. More muscle is pushing here on the left side than it is on the right side, because that initial force of that muscle contracting has to go throughout the body. You have to pump blood all the way to the tips of your toes, to the top of your head, to the tips of your fingers, and then back again. So that requires a lot of pressure. So that's why you got a lot of muscle on that left ventricle there. And then once it becomes deoxygenated, it's going to go out the aorta, which is the largest artery. It's going to branch out into smaller arteries, and then eventually it'll break down into arterioles, and those arterioles are going to break into a capillary network, and those capillary network is where the oxygen in the blood is going to be transferred into the cell, and that cell is going to give out that carbon dioxide into the blood, and then that deoxygenated blood is going to go to a venule, and then a vein, and then into the bigger vein, the superior and inferior vena cava, and the whole cycle comes back through again, back into that inferior and superior vena cava, into the left atrium, through the tricuspid valve, into the left ventricle, out the pulmonary artery to the lungs back to the heart via the pulmonary vein, into the left atrium, through the bicuspid valve, the mitral valve, into the left ventricle, out the aorta, into the arteries. So that is the route of blood through the heart and the structures of the heart. So I hope that helped. Hope that it was a good review. So if you want to, there we go. Nope, that's the descending aorta. Right there. So right there is that pulmonary vein, that hole right there, leading that oxygenated blood into the left atrium. So I really hope that helped. If it did, be sure to hit that like and hit that subscribe button for more videos on reviews like this.